He pays just under 400 Singapore dollars for a full body checkup. Normally it would cost him $800. He paid about $1,600 to close a wound on his right thigh, half of the amount he too would normally have to pay.
It's the best place, nice hospital, good service.
Every day, an estimated 100,000 people travel across this bridge between Singapore and Malaysia for work, school or leisure. Singaporeans are also known to travel across to buy their groceries or daily necessities. At a current exchange rate of around 2.4 ringgit to 1 Singapore dollar, much savings can be made, especially for Singaporeans. And now, there's a new draw. Private hospitals in Johor Bahru are now seeing Singaporean patients seeking treatment. One newly opened hospital in Bandar Seri Alam, just 20 minutes from the causeway, has seen at least 40 Singaporean patients in the last year. Orthopedic surgeries and regular health screenings are among the more popular treatments. It's because these can be scheduled ahead of time.
By percentage-wise, I would say actually healthcare cost would be 50% cheaper. This is primarily caused by the exchange rate. For example, say a knee replacement surgery. A knee replacement surgery in a private hospital setting in Singapore would cost in the region of 15 to 17,000 Sing. Okay? So 15 to 17,000 Sing. Here I do it for 15 to 17,000 ringgit.
Raja Shahdan is one such cross-border patient. Early this year, due to an improper administration of a vitamin C injection, Raja Shahdan found himself with a foot-long abscess. He went to a Singapore government hospital and was prescribed antibiotics, but the abscess remained. His last resort was to seek a specialist's opinion. By then, his thigh muscles were already infected. He had to go for surgery to drain out the pus. The operation alone cost him 8,000 Singapore dollars, 1,600 he paid using his MediSave. Even after that, he needed daily dressings, which cost him 94 Singapore dollars each time. This came out of his own retirement savings, as Raja Shahdan was unable to use any more of his MediSave for the specialist treatment.
I really get worried because the saving that I keep maybe using a lot. Then I bought my own dressing, about 1,000 plus on the dressing itself.
2 months later, Raja Shahdan had to close up the open wound, and he would have to fork out another 3,000 Singapore dollars to stitch it up. His doctor offered to complete the surgery for him in Malaysia instead. As it was the first time Raja Shahdan would be undergoing an operation overseas, he was hesitant. Before going to JB, what was your opinion about healthcare in Malaysia?
Yeah, some of the normal hospitals, I heard it's very bad. I know in the newspaper I read, it's very bad, their service. After the operation, they left the scissors inside, and some baby had been chopped off.
I think it very much depends on the institution itself. Yeah. Generally, I think in Singapore, we are okay. In Malaysia, I suppose it is still not too bad. Yeah, it is comparable, I think, in many sense. Except that the cost in Malaysia, I would certainly think that it is much cheaper across the board.
As I see, I spent so much already on the operation, so I need to save some money. Then he said to save the money, I said go to Johor, to the operation. He said, okay, I myself do the operation over there. Oh, he said on every Thursday he went over the side there. So I got confident because I know him already.
Dr. Liu is Raja Shahdan's doctor, and he's also one of 4 doctors at Regency Specialist Hospital with dual residency. He's certified to practice both in Malaysia and Singapore because he's a Malaysian-born Singapore PR doctor. Doctors like him operate out of their private clinics in Singapore and travel at least once a week to Malaysia to conduct surgeries and treatment. According to their own discretion, these doctors are able to refer Singaporeans to a Malaysian hospital that they practice in. Undergoing the same operation in Johor Bahru would cost Raja Shatan 1,600 Singapore dollars instead of the $3,000 he would have to pay if he did it here in Singapore. Because it was so much cheaper, he decided to head across the causeway to become a patient.
I'm really surprised because when I asked Dr. Liu, so I don't know to go in there. Where's the place? I don't know. He said, don't worry. The limousine will fetch you out and send you back home.
I think that the appeal would be that they would be able to use the same doctor, the confidence level, and as well to know that there is significant savings in terms of the total expenditure they would be spending for their medical care.
But is cost the only attraction? And what about the quality of healthcare? Get Real decided to cross the causeway to check out some of these Malaysia private hospitals. You see, hospitals and medical centres are actually just a stone's throw away. And after clearing customs, it'll take us about less than half an hour to reach Regency Specialist Hospital. This is the hospital which Raja Shahdan did his treatment at. It's not officially open, but according to their records, at least 40 Singapore residents already had medical procedures done here. Singaporeans make up 1.5% of the clientele, and the others are mainly locals and Indonesians. And the prices are extremely competitive. A bed at an A-class ward in Singapore General Hospital will cost 300 Singapore dollars a night. A bed at the suite at Regency Specialist Hospital in JB, comparable to an A-class ward in Singapore, costs 145 Singapore dollars. That's half the price. Surgeries and procedures are cheaper as well. Let's take a hip replacement surgery. A B1 ward patient would have to pay about 17,700 Singapore dollars at SGH, even after a government subsidy. It will cost them $8,000 for a similar operation and ward at some private hospitals in Malaysia. Another example is a colonoscopy. The subsidized rate in Singapore will cost about $550, while the similar operation costs between $250 to $400 at these private hospitals in Malaysia.
I think the target audience would be the B2 restructured patients. By coming here, they will be getting private healthcare at the cost of institutional treatment in Singapore. And medication cheaper, rooms cheaper, they can stay much longer.
After the break, Get Real finds out how hospitals in Malaysia are trying to woo the Singapore crowd and just why healthcare is so much cheaper across the causeway.